Hello and welcome to my YouTube channel, Show Up Prepared. My name is Jean Armand. I've been a nurse for 38 years. That's right. I've been a nurse for 38 years, nurse practitioner for 23 years. So my background is that I started in the telemetry unit. I probably did 6 months to a year in telemetry unit. Then I transferred to critical care unit where I worked ICU, CCU, surgical ICU. I then transferred into the emergency room setting, which that was my love. I love the emergency room because of the variety. I didn't necessarily like the routine of taking care of the same medical conditions, same people all the time. I like variety. I like the fact that we can take care of children, babies, all the way to the elderly. So that was my passion. And I really enjoy, and just you have to be, I felt like it was good for me because it caused me not to forget all that I learned. I could just, it's not for everyone, but that's my thing. I like the variety. I like the speed. Yes, most of us are just, that's what we like. So, over the last years, I've worked and also in an anesthesia clinic. I worked in a level 1 trauma center, and I did on a trauma unit, and then I also worked, like I said, my last hospital job was an anesthesia clinic where I was the manager, and then I would say it's almost 3 years now I've been owner. I'm a franchisee, so I own the location of Prime IV Hydration and Wellness in Smyrna. Prior to this, 5-7 years ago, I also used to have a podcast called the Health Flow Podcast. And I've always had a passion of I wanted people to know more about their health and to help them navigate the healthcare system. So there is a disparity there with patients, clients, sometimes not, as medical providers, us not giving them the information, or it's not sometimes that we don't give it to you, but when you're in an emergency, when you're in a crisis, it's only so much that you can take in, and plenty times people leave hospitals feeling that they're uninformed, but it's just because of where they are and they just can't take in all the information. So I wrote a journal. It's called Show Up Prepared. Show Up Prepared is a medical journal, and on this, I'm going to show up once a week, every week, so we can go through this together, because I want you to show up prepared. I want you to show up to your doctor's office prepared. If you're transferring care from one physician to the other because you moved, you need to have something that you show up prepared. Let them know you are an engaged person in your own health. If you're going to have surgery, what medications are you taking? What are you allergic to? Previous surgeries you've had. What insurance do you have? Who's your medical provider? There's just so many things that, you get into the hospital, and not only, it's one thing if you're planning that, a surgical procedure, that's fine. But what if you have an emergency? We know emergencies happen. The 3 a.m. running to the hospital, or you get to the hospital and you're not able to speak for yourself, but then your families know nothing. So it's almost like a little guesswork. Yes, the medical providers know how to treat the illness that you present with, but if they're not aware of other pre-existing conditions, allergies, I know everybody knows about penicillin allergy, but you could be allergic to anything. Um, Allergies, previous surgeries, those are all clues and necessary information that's needed. So that's why I want us, it's my passion. I want us to be well informed about our health and to have all the necessary information. It's important. It really is. Um, so here's what so like I said, I created Show Up Prepared because of my 38 years of experience in nursing. And I see what happens when families are in a health crisis. And I've seen the relief, the actual relief on people's faces when they are prepared. This journal is $16.99. It's available on Amazon. That's $16.99. Every family should have one. Individuals, your parents, your aunties, your uncles, grandparents, grandma, everyone should has it. It can literally save so much time. And I'm hoping that you'll, go ahead and get it so that you can even go ahead now and get it so that when I come back next week and each week we can fill it out together. I challenge you to not just get it. When you get it, make sure you're writing that information in pen and we can do, one section a week. So I have a link on the screen for you to click on that link to get the journal. And I hope if this video helped you, or if you know somebody who may need it, please share it with them. And if you want real healthcare advice from somebody who's been doing it for nearly 4 decades, hit that subscribe button, why don't you? I'm going to be here every week sharing what I've learned. You can ask me any questions. Please, I'm going to walk you through exactly how to fill out the healthcare journal step by step. We're going to do it together. I'm Jean Armand. Pick up your journal. Here it is. Show up prepared. Stay prepared. Stay safe. I will see you in the next video. All right. Take care. Show up prepared. All right. Thank you so much.